We're at the Greensville Gourmet for the annual charity barbecue for Lyme disease, and this is becoming very, very big in the news today. A lot of people don't know that much about it, but I think it's becoming prevalent because a lot of people like to get back to nature now, like to take walks out in the woods, and it's causing a lot of problems for a lot of people, and we're fortunate here. They're raising funds here today at the Greensville Gourmet, and also we have Ellen from Lyme, Ontario, to tell us a little bit about it and maybe give some information that you may not know. And again, this is for people, and a lot of people now, Ellen, like to go out and get back to nature and do some walking in the woods, but you got to be careful there. So first of all, tell us what actually is Lyme disease and how come it's suddenly become a big deal.
Lyme disease is something that people expect to be in fields and if you're hiking, but the truth is it's right in our backyards. It's right in our school grounds, anywhere where there's birds, animals, mammals. You get it from an infected tick who will bite you. There's misconceptions about how long the tick has to be attached, but it has been proven the minute the tick attaches and engorges and starts feeding on you, it can transmit the disease.
And what is the disease? Because again, it just seems to be little known, little diagnosed. No one seems to know much about it, even professionals.
Yes, Lyme disease is from the tick, which causes an infection in your body. It can affect your heart, your limbs, your brain. It can cause muscle, joint aches and pains. It will rummage through your body and it can destroy organs. And left untreated, it can be fatal. And
why isn't the medical profession not able to diagnose this?
Canada follows the current CDC and the IDSA guidelines in the United States, which states that after 30 days, you're cured. Anything past that, it's just residual effects of the disease. And we as Lyme patients know, I personally myself was bedridden for 6 months. I couldn't function as a mother or wife. 2 years of antibiotics, I'm about 60% better. So it shows that although they think the 30 days is enough, it's not enough.
Okay, so we were out in the woods for a walk with the dogs or whatever, just by ourselves. We're working in the backyard, doing some gardening. What do we need to do to protect ourselves?
You need to be aware. The number one thing we tell people is you have to do a tick check. You have to check your body. Ticks right now can be the size of a poppy seed that can infect you and make you sick. You need to check behind your knees, your ears. They love the navel, the toes, the hairline. They're so small, but you need to do those tick checks because that's the way you find it. Some, if they're lucky, will get the bullseye rash, which is not as common as people like to think. It can be different kinds of rashes. If you get the bullseye, you have Lyme disease. Your doctor will usually start antibiotics right away. But if you don't have the rash and if you don't see the tick, people are turned away saying, no, your symptoms cannot be Lyme disease because you didn't have these issues to begin with.
So if you have a rash, go to the doctor right away.
Go to the doctor right away. Those who don't have the rash, unfortunately, have to prove their case to the doctor.
Okay, and for more information?
Go to www.lymeontario.com.
Okay, thanks, Ellen.
Thank you very much.